Hello guys, my name is Dr. Kia. I am a medical doctor with more than 10 years of experience in the medical field and also as a researcher in the nutrition and supplement field for about 14 years. I like to share my knowledge and my experience with you guys regarding some disease and conditions. And I try to show you some solution through following a healthy diet and lifestyle. I try to explain the material with simple language to you guys. If you like my videos, click on the thumbs up icon and subscribe so you could be able to watch my future video easily. You can share my videos with your friends or people with the same condition or disease. In the first part of my video, I explain diabetes symptom, its side effect, people who are susceptible to diabetes, and the most common test for diagnosis of diabetes. In this part, I am going to talk about lifestyle and first part of the diet. Here is some advice that I suggest to you regarding delaying or preventing diabetes by diet and lifestyle. Let me talk about lifestyle first. I start this part with a question. What is the most important factors for improving diabetes? The most important factor for improving diabetes is controlling weight. If you are overweight or obese, you can lower your body weight by consuming a low calorie diet and doing exercise. According to a study by Cambridge University, people who achieve a weight loss of 10% or more in the first years of diabetes have the greatest chance of reversing diabetes. Second, another important factor for controlling or improving diabetes is exercise. Many studies have found a significant association between physical inactivity and type 2 diabetes. Exercise do its helpful effect through several different mechanisms. First, when you do exercise, your muscle don't need insulin for using glucose because during a single session of physical activity, contracting skeletal muscle enhance glucose uptake into the cells. In addition, physical activity has also been found to reduce intra-abdominal fat, which is a known risk factor for insulin resistance. In general, physical activity has been inversely associated with fat distribution in body and can reduce the body fat stores. Guys, remember, the more you have fat, the more you have a chance for insulin resistance. So in general, exercise helps you against insulin resistance by both reducing the fat and building up the muscle in your body. Third, the duration of exercise is also an important factor. It should be at least 150 minutes per week. So, for example, if you go for a workout 5 days per week, every session should be about at least 30 minutes. And if you go 3 times per week, every session should be 50 minutes at least. Both weightlifting and aerobic exercise are helpful. Especially heavy lifting could be very beneficial because in the long run it can increase muscle mass and as a result lower insulin resistance. According to studies, timing of exercise is also another important factor. For example, people doing exercise before breakfast and in a fasting state burn twice fat compared as people doing workout after breakfast. But the diabetic patient should be aware of hypoglycemia in this case and have snacks containing carbohydrate during the workout. Everybody knows that smoking is a bad habit and is harmful to health. Smoking increases the risk of developing diabetes and aggravates the micro and macrovascular complications of diabetes mellitus. In general, a smoking cessation is one of the most important targets for diabetic control and prevention of diabetes complications. Another factor is alcohol. The American Diabetic Association states that moderate alcohol consumption has minimal harmful short or long-term effect on blood glucose. In people with diabetes, with some epidemiologic data showing that improving glycemic control with moderate intake. Another important factor is stress. Both physical and emotional stress stimulate the release of various hormones, which can result in elevated blood glucose levels. So, by avoiding emotional and physical stress, you can lower insulin resistance in your body, which is achievable by doing exercise and meditation regularly. Another thing is sleep. According to studies, a nighttime sleep duration lower than 6 hours per day is associated with type 2 diabetes. Now we can talk about diet. Before I start about diet, it is important to know that all the recommendation and information here for diabetic patients work effectively for pre-diabetic patients too. By following a healthy diet and lifestyle, the pre-diabetes condition can control much easier and faster than diabetes. The American Diabetic Association has defined self-dietary management as the key steps in controlling diabetes. The role of diet in the etiology of type 2 diabetes was proposed by Indian, who observed that the disease was almost restricted to rich people who consumed oil, flour, and sugar in excessive amounts. During the First and Second World Wars, decrease in diabetes mortality rates was proven because of food shortage and famine in the involved countries such as Germany and England. In Berlin, the diabetes mortality rate declined to half over the period of World War I. In contrast, there was no change in diabetes mortality in other countries with no shortage of food, such as Japan and United States. Here are some guidelines about the role of nutrition in controlling diabetes. First, achieve and maintain body weight goals. Second, plan to individualize glycemic blood pressure and lipid goals. And so before we start about type of nutrients, it is important to know that the total calorie consumption should be based on weight loss or maintenance in diabetic patients. The total amount of carbohydrate consumed has the strongest influence on glycemic control. Many clinical studies indicate that low carbohydrate eating habits may result in improving glycemia and ability to reduce anti-hyperglycemic medication for individuals with type 2 diabetes. However, low carbohydrate diets are not recommended for pregnant and lactating women and those who are have eating disorder and those with kidney disease. The American Diabetic Association recommended the following foods for better blood sugar control. 1. Nutrient-dense carbohydrate sources that are high in fiber, including vegetables, fruits, legumes, whole grains, as well as dairy products. For diabetic people who are under a flexible insulin program, educating on carbohydrate counting is an effective way of controlling blood sugar. For individualized for individual whose daily insulin is fixed, a consistent pattern of carbohydrate intake with respect to time and amount may be recommended. It is strongly recommended to avoid sugar sweetener beverage, including fruit juice. Sucrose, also known as table sugar, is a disaccharide composed of one glucose and one fructose molecules and provides 4 kilocalories per gram. Consuming sucrose has many harmful effects on blood glucose. Based on many clinical studies, consuming starch has the same detrimental effect as sucrose. Fructose is a common naturally occurring monosaccharide found in fruits, some vegetables, and honey. Fructose consumed in food such as fruits, which also contains fiber, may result in better glycemic control compared with sucrose or starch, and free fructose is not likely to have harmful effect on blood sugar if the amount of intake does not exceed 12% of daily energy. High fructose corn syrup is a high in processed fructose and is used commonly in processed foods as a less expensive alternative to sucrose. People with diabetes should avoid or limit their intake of any calorie sweetener, including high fructose corn syrup and sucrose. Other categories are non-nutritive sweetener, which could be helpful in diabetic patients, and they are classified into two categories. The first group is synthetic sweetener, which includes sucralose or Splenda, saccharin sugar or twin sugar, acesulfame K, neotame, and aspartame or equa. According to many clinical and paraclinical studies, none of these sweeteners in normal amount have any side effects. In general, they don't increase blood sugar or insulin levels in patients with diabetes. The second is natural sweetener, which I recommended to you guys, and including stevia and lujango, are generally safe and have no calories. Another nutrient is fiber. Patients with diabetes should consume 20 to 35 grams of fiber from raw vegetables and unprocessed grains per day. Intake of dietary fiber is associated with lower all-cause of mortality in patients with diabetes. A fiber-rich meal is digested more slowly, which promotes satiety, contains fewer calories, and lower in added sugar, which can help prevent obesity and reduce the risk of heart disease, type 2 diabetes, and colon cancer. Other nutrients are resistant starch and fructans. Resistant starch are enclosed within intact cell walls. These include some legumes and starch granules in a raw potato. Resistant starch are completely fermented in the colon, which is helpful for the intestinal bacterium. According to studies, resistant starch may affect glucose response after meals and reduce the fluctuation in blood sugar. Fructose is another indigestible fiber that lowers the glucose in the blood. Inulin is a fructose which commonly added to many processed foods in the form of chicory root. A recent review of 20 randomized clinical trials shows that inulin-type fructose could lower blood glucose and increase HDL or high-density lipoprotein, which is the good cholesterol in type 2 diabetic patients. Here are some practical tips on carbohydrate intakes. Intake a good source of fiber containing food with every meal or a snack. Add some whole grains to the morning meal without adding sugars. Use whole grain bread for lunch or snacks. Check the label to make sure that the whole wheat or another whole grain is the first ingredient listed. Eat fewer potatoes. Instead, try brown rice or less well-known grains such as wheat berries, millet, or quinoa. If you like pasta, switch to whole grain pasta. Newer pasta products made from legumes such as chickpeas are now available. Try to consume beans or legumes, which are an excellent source of slowly digested carbohydrate. Try to include a variety of fresh fruits and vegetables in meal every day. Okay guys, this part was the second part of our discussion. I will continue the diet part in future videos. If you have any question, please ask me on this page. If you like my videos, as I mentioned before, click on the thumbs up icon and subscribe so you could be able to watch my future videos. Thank you for watching and being careful about your health.